Hi, I'm Catherine. I'm a physical therapist here at Billings Clinic in Bozeman, and I'm here to present to you our total joint replacement education course together with Alpine Orthopedics. Today, I'm going to go over a lot of information regarding what to expect during your total joint replacement surgery. We're going to go over your pre op schedule, what will go on in your surgery center arrival, what will happen during your stay, your physical therapy, and your post surgery expectations. Your joint replacement team is consistent of several different people: your orthopedic surgeon, your physician assistant who will assist the surgeon, your pre surgery nurse who will help you get ready for your surgery, the medical assistants that help take care of you along the way, the registered nurses that will also assist in your care, and your physical therapist who will help in your rehab post operatively. Before you have your surgery, there's a number of appointments that will need to be done before you can be have your procedure completed. Your pre-op clearance is going to be done through Bozeman Health Pre-Anesthesia Clinic, or PAC. During that appointment, you will have your surgical optimization, which means your labs will be drawn. They may check your heart through an EKG. They will go over all your medications and make sure that um, you are aware of when to stop and start each medication, make any changes, and to also be aware of any other health conditions that have come up or haven't been checked into recently. Patients can also obtain preoperative clearance through their primary by request. You have several other preoperative appointments that need to happen before your surgery. We just talked about your preoperative medical clearance through the pre-anesthesia clinic. After that appointment, they may have you see some specialists, including cardiology or pulmonology, maybe diabetes education, or endocrinology. You also have to have a dental clearance. So you'll need to see a dentist and have your clearance faxed to the Alpine Orthopedics office to be sure that you're safe to go into your surgery. You'll also need to have a physical therapy pre-op appointment at Billings Clinic. Before your surgery, we also need to have a MRSA swab. MRSA is a type of bacteria that's very common to be found on the body, and we need to determine if you have it and how much you have. This is a pretty normal thing that people carry, and we just want to make sure that you aren't at increased risk in getting this bacteria into the wound. So they'll do something called a nasal swab. If your swab is positive, your provider will follow up and let you know what your treatment plan is. This won't stop your surgery, but it will require just an extra step in your treatment before your surgery. Another pre-op test that sometimes comes up is COVID testing. COVID testing is only performed for patients who are symptomatic. Surgery can be delayed if you're positive or symptomatic, but your provider will discuss that with you. A couple of things to go over in terms of your pre-op preparation. It's important to stay as active as possible before your surgery. Continue to exercise as you are able. You'll want to attain a front-wheeled walker. This is preferred over a four-wheeled walker. And all that means is that there's two wheels on the front and no wheels on the back, instead of a four-wheeled walker, which has four wheels. The reason why we don't recommend a four-wheeled walker right away is that they're just a little bit more unstable and have a higher risk of people falling after surgery. These can be used in the future when you become a little bit more mobile, but we recommend that you start off with a two-wheeled walker or a front-wheeled walker. It's important that you have arrangements to have someone come drive you home after your surgery and someone to stay with you for at least 2 nights. Since most of you are probably on several medications, it's important to know when to start and stop these. The nurses will go over them with you before your surgery to let you know exactly when to start and stop. This is done on an individual basis. The pre-anesthesia clinic will do this, and then also the nurse that will go over and give you a phone call right before your surgery to go over this one more time so you don't forget. Any questions you have about this, please direct this to the pre-anesthesia clinic or to your provider before the surgery. It's important to prepare your home before your surgery. You want to place any frequently used items in easy access, all on one level. Try to get your home clean, get your laundry done ahead of time, change the linens on your bed, and remove any obstructions in the hallway or any clutter on the floor, any loose rugs or mats. And if you can, prepare some meals ahead of time. Another thing you can do to make your home safer is to install some night lights in dark areas, place some non-stick strips in the tub or shower, make arrangements for someone else to care for your pet so they're not under your feet, making a trip hazard, and make sure that you have all your equipment needed and that it's clean and in working order. For example, your walker, or if you want to borrow a raised toilet seat or any grab bars and things like that. The day before your surgery, you will get a call with information on when to arrive, when to stop eating, and when to stop drinking water or Gatorade. It's important that you'll purchase a 20-ounce bottle of white or yellow Gatorade with sugar to be consumed the morning of the surgery. Do not have purple, blue, orange, or red Gatorade, only clear liquids. This will be reviewed in detail with the pre-anesthesia clinic and your nurse that will call you the day before. The day of the surgery, it's important that you follow the instructions on the time to stop drinking the water and/or Gatorade. Do not eat anything including candy, cough drops, or gum before your surgery. Please do not put on any body lotion, deodorant, or put in your contact lenses. Do not shave for 3 days before surgery except for your face. And please do not use any marijuana products, tobacco products, or alcohol at least 24 hours prior to your surgery. Before surgery, it's important to prep your skin to avoid any extra bacteria getting into your wound site. To reduce the risk of the infection, you will need to wash with a special soap that will be provided to you. The soap is a 4% chlorhexidine gluconate soap. You will wash 3 times total. The first time is 2 days before your surgery. You'll wash again 1 day before your surgery, and again the morning of your surgery. You'll wash from the neck down and avoid the genital area. Do not use lotions, creams, or ointments after washing on the day of the surgery. If a rash develops, please contact your surgeon's office. Preparing for your surgery. On the day of your surgery, please bring your glasses, your dentures, your hearing aids, and their cases. Bring a few toiletries, your cell phone. If you have a CPAP machine, please bring that, and some comfortable clothing that will fit over a bulky dressing. What not to bring: cash or valuable jewelry. Do not bring your home medications or other valuables. When you arrive to check in for your surgery, at Alpine Orthopedics, you'll go to the main entrance and check in at the front desk for the surgery center. If your surgery is at Livingston Healthcare, please check in at the main entrance at the front desk. You'll need to bring your photo ID and your insurance card. When you arrive for your pre-op right before your surgery, the nurse will finish going over a few forms with you and have you sign a few things. Your nurse will check your weight and your vital signs. One more skin prep may be performed at that time. An IV will be started. You'll meet your anesthesiologist and sign your consent forms. You'll meet your OR nurse, the one that will go back with you during your surgery, and the surgeon will come and sign your surgical site. After your surgery, which takes about 90 minutes, you will be discharged. Once you'll arrive to the post-operative bed. Once you're stable and safely ambulating, you'll be able to go home. You'll follow up with physical therapy in 24 to 48 hours if you've had your knee replaced. If you've had your hip replaced, you won't have follow-up physical therapy right away. And you'll follow up with orthopedics in 2 weeks post-procedure. If you've had your knee replaced, you will have a large incision down the front of the knee. And if you've had your hip replaced, there's 2 different ways that the surgeon may go in. One is called an anterior hip replacement. You'll see there on the left the short red line on the front, or a posterior hip replacement, which the incision's a little bit longer and more on the lateral side. There are some instructions for your wound care, which the nurses will go over with you before you leave your surgery center or the hospital. If you've had a total knee or a partial knee, your knee will be, or a knee revision, your knee will be covered in a large ACE wrap. Underneath, there's some cotton padding, and that's going to remain in place for 48 hours or your first PT visit. That's when you'll arrive to PT and the therapist will take off that dressing. Please leave that in place until that visit. Underneath that layer, there's something called an island dressing. That's a waterproof dressing that's over the incision. You're going to remove that at 10 days after your surgery. You can remove that on your own. That dressing is waterproof, but we do recommend that you cover it when you shower, just in case that there's an accidental leak. And underneath that layer, there is a third layer of a dressing. That is called the silky dressing. This silky dressing is a white mesh dressing that's directly on top of the wound that's holding it together. You won't see any stitches or staples. The white mesh is holding your wound together. You're going to leave that in place. You won't actually see that dressing until you're 10 days out when you remove that island dressing that's on top of it. It's okay to let the water run over that silky dressing in the shower. If you have any questions, you can go to the Silky website, sylke.com, where you can see what that dressing looks like. The surgeon will tell you when that dressing will be removed. When you leave your surgery center, you're also going to come home with something called an incentive spirometer. This is a tool to help inflate our lungs, make sure we're taking deep breaths, and help us get off oxygen quicker and prevent pneumonia. When we're on strong medications like narcotics, it depresses our respiratory system and we sometimes forget to take deep breaths. So this machine is very important to use post-operatively. Your nurses will review it with you after your surgery. It's to be expected that you will have some significant pain after your surgery, unfortunately. You will be frequently asked about your pain rating. Please inform your nurse about the effectiveness of your pain management. It's important that you ice every 2 hours for 20 to 30 minutes. An ice machine will be provided if you've had your surgery at Livingston Healthcare, and it can be purchased if you're having surgery at the Orthopedic Surgery Center of Montana for $300. It's also important that you take your pain medication according to schedule provided by nursing staff and your surgeon and the physician assistant. Physical therapy. If you have your surgery in Livingston, a physical therapist should attend to see you the first day out of surgery. They'll help you sit up at the edge of bed and get you walking when appropriate. If your surgery is at Alpine Orthopedics, you will have a nurse help you get walking for the first time. And then you will attend your first physical therapy visit at 48 hours post-operatively. If you've had your knee replaced, you'll attend physical therapy for 2 to 3 times a week for 6 weeks. If you've had your hip replaced, you won't attend physical therapy for at least 6 weeks. Make sure you take your pain medications prior to physical therapy. There's a couple important things to go over if you've had your hip replaced, something called hip precautions. They're different whether or not the surgeon goes in from the front or the back. That's called anterior versus posterior. Your surgeon will tell you which way he's going in for your surgery. We'll go over those in just a minute. In terms of your weight bearing, there's usually no restrictions, but if there are, your surgeon will let you know, which means you can put as much weight on your leg after your surgery. When you initially start walking, for both a hip and a knee, you will use a walker, then often progress to a cane, and then no assistive device. Okay. If you're going to have your hip replaced, there's a couple things we need to review for your precautions. If you have the anterior approach, which means he goes in from the front, he does not want you to kick your leg out straight behind you. Doesn't want your leg to go out to the side, and he doesn't want your foot to rotate too far outwards. If you have your hip replaced from the back, which is called a posterior approach, your surgeon does not want you to cross your knee over your knee. He doesn't want you to turn your foot inward like pigeon toes. And he doesn't want you to bend your hip more than 60 degrees for 6 weeks and more than 90 degrees from 6 to 12 weeks. He also he wants you to avoid crossing your leg through the midline of your body to the other side. If you've had your knee replaced, it's very important that you don't put anything underneath your knee when you're lying down. That includes a pillow or a towel. You can put your knee straight and encourage straightening by putting something under your heel, but nothing under the knee. It will cause your knee to stay bent and make it very difficult for your knee to be all the way straight. And this will cause you to walk with a limp. Avoid extremes of motion when you're getting dressed, showering, bathing, putting on your shoes. And it's a good idea to practice going up and down the stairs before your surgery, going up with the good leg first, taking steps one at a time, and going down with the bad leg first. It's important to practice getting in and out of your house and then up and down to where your bedroom is, so that when you come home from the hospital or your surgery center, you've done this before and it's more familiar to you. When you come to your surgery, please bring loose fitting, comfortable clothing that will fit over a bulking dressing. Your limb will be very large after your surgery. Please bring slip-on shoes. It's much easier to put those on when your leg is very swollen. It's normal to find post-operative pain, swelling, and bruising. Some of this can be quite concerning. So I'm going to tell you when would be cause for alarm. Make sure you take your pain medication, use ice and elevate, and call for refills 72 hours ahead of time. Swelling can be very normal after joint replacement surgery. But if you're having a rapid increase in swelling, we would want you to call the doctor's office. Bruising can also be very concerning looking, but it's also very normal. It can also show up several days later and be very different color, show up in varying colors all the way down the leg. But if you are concerned, please call the doctor's office to discuss. Okay, to review your post-procedure care. This is the same for your total hip and total knee surgeries. Make sure you remove that island dressing 10 days after your surgery. You can shower with that dressing covered once your bulky ACE wrap has been removed by PT. If you're a total hip, you won't have that bulky ACE wrap. No bathtubs or swimming for 3 months. No ointments, creams, or lotion on the incision. Notify your surgeon of any drainage, odor, increased pain, or redness along the incision. It's important that you let your dentist know that you've had this procedure. The doctor recommends you don't have any dental work for 3 months after the procedure unless it's an emergency. Dr. Sukin recommends that you have lifetime antibiotic use prior to any dental procedure for the rest of your life, including cleanings. You'll call the doctor's office to obtain your antibiotic. Another complication that sometimes comes up that we want you to be aware of is a blood clot, also known as a DVT. Some of the signs that we would see for that is swelling in the thigh, the calf, the arm, or the ankle, and it doesn't subside with rest or elevation. You may have increased pain, heat, and tenderness to the calf, the back of the knee, the groin, or the underarm. Please notify your provider. The provider will order an ultrasound if they believe it's necessary. It's really important that you take your prescribed DVT prevention medication. Make sure when you leave the hospital that where it clearly states your medication paperwork, note the medication, the dose, and the duration. Don't stop taking this medication unless your surgeon or primary care provider have told you to stop. Another complication is a pulmonary embolism. This is a blood clot that's traveled all the way to the lungs. Some of the signs are chest pain, sudden shortness of breath, sweating, or confusion, and this is an emergency. Please call 911 and get yourself to the ER if you're having these symptoms. Another complication can be constipation. This is quite common for patients who are on narcotic medications. It's important that you take your daily stool softeners, increase your fiber intake, fluids, and call your provider right away if you are not having regular bowel movements. In terms of post-op driving, if you've had your left hip or left knee replaced, you can drive once you're off the narcotic medications and you can safely get in and out of the vehicle. If you've had your right hip or right knee replaced, it's okay to drive once you are off your narcotic medications and at least 2 weeks post-op, and you can safely move from foot to brake to gas. So in review, here's a couple things you need to remember to do. Please designate your coach and arrange for help post-operatively. Make a list of all your current medications. You'll be asked this more than once to provide them. Obtain your appointment with your primary care or the pre-anesthesia clinic. Prepare your home and get ready for your surgery. Continue with your home exercise program. Have your pre-op dental exam. Also make your physical therapy appointments if you're having your total knee replaced. If you have any other questions, please contact us here at Billings Clinic. Our number here is 406-898-1470.